Musculoskeletal injuries are often caused by a training error. This means there's an imbalance in how much load the tissue can take and the amount of load that is being applied to the tissue. In other words, if you run, for instance, suddenly 10 kilometers while your body is only used to running 5 kilometers, that actually means that you get more tissue breakdown than the body is able to recover, and this subsequently can cause injuries. It all depends what the cause is of the injury. If the cause is if the cause of the injury is a training error, you obviously have to go back and see how you can adjust your training program so your tissue has time to recover and heal. If it's a more chronic issue, then you often have to come up with a bit more smarter solutions and trying to address the underlying cause, as well as trying to come up with a smart solution that helps in healing the tissue again. Because in the end, only healthy tissue can bear. The solution for a chronic injury or sports injury can be quite complex. It all depends what is the underlying cause. If it's a training error, it could be relatively simple, and you could basically adjust your training load, give your body time to heal, and so the injury will fade away. However, if it becomes more chronic, you have to come up with some smarter solutions, and that actually requires a proper assessment where you actually look at some of the what is really driving the injury, what are the contributing factors, and whether there is already tissue damage. And medical imaging, for instance, can be an important tool in assessing what is causing the pain and whether there is actually structural damage to certain body parts like tendons or joints.